So fungal infections. Now, for fungal infections, you need to know that the class of fungi are divided into, you have dermatophytes, dermatophytes, you have epidermophytes, and then the last one, you have the systemic fungi. Is it clear? So those are the three major class of fungi when you want to understand. The first one that you're going to start with are the epidermophytes. The second ones are the dermatophytes, and the last one are the systemic fungal infections. So let's start with the epidermophytes. Basically, the epidermophytes, you need to know that they generally affect the epidermis of the skin. Basically, and those ones that affect the epidermis of the skin, there are different ones that affect the epidermis of the skin. So you need to know that you have the trichophyton, basically the trichophyton, basically like the trichophyton rubrum. The second one, you have the microsporum oduini, basically. Microsporum oduini. Now the next one after the microsporum oduini, the third one, we are going to have the epidermophyton rubrum. So we have the trichophyton tinea pestis. So those are the three major microorganisms involved with the epidermophytes affecting the epidermis. You have the trichophyton rubrum or the epidermophyton rubrum. They are the same thing. You have the microsporum oduini and you have the tinea pestis. Now among these three, they can result to all of them result to infection of the epidermis. But you need to know that the trichophyton or the epidermophyton rubrum generally affect the body, the corporeal. Is it clear? The corporeal, all the body is. So when you have corporeal eczema or eczema as a result of the fungi, it is mostly as a result of trichophyton rubrum, but other one can also result to that. The most one which is involved in the corporeal infection of the fungi, it is much more of the trichophyton rubrum, general infection of the skin. Now generally when you have infection of the scalp, is it clear? Eczema of the scalp, you have to much more think of the microsporum oduini. Is it clear? When you have eczema of the scalp, you think much more of the microsporum oduini. And the last one, when you have eczema, when you have at the level of the level of the fingers, is it clear? In between the fingers, and it is very pruritic. Is it clear? Like in the case of tinea pestis. Is it clear? So when you have tinea pestis is much more an athlete's foot. In case of athlete's foot, where that is smelling and then it is pruritic, it is the cause. Is it clear? So you have tinea pestis. All that is, so this tinea pestis now is involved now with the infection of the athlete's foot. In the case of athlete's foot, where you have pruritus in between the toes or pruritus in between the fingers, is it can also affecting the nails. Is it clear? So tinea pestis. So all those are and it's pruritic. All those are the infection involved there. Now the next part, we are going to have the dermatophytes. After the epidermophyte, you have the dermatophyte. Generally, infection at the level of the when you have the infection at the level of the dermis, is much more in immunocompromised patients. Is it clear? Immunocompromised patients. When you have dermatophyte infection, an example of dermatophyte infection is candidiasis. Is it clear? And the candidiasis can involve candidiasis of the oral mucosa, affecting at the level of the tongue, the mucosa of the tongue. That is also already at the level of dermatophyte. You have also candidiasis of the genital tract, genital candidiasis, which results to pruritus mostly in female with thick whitish discharge or thick egusi-like discharge or thick cheesy-like discharge. So that is candidiasis. Mostly it's involved in the dermatophyte infection. Is it clear? Now the last one, you have the systemic when you have systemic fungal infection. For the systemic fungal infection, you need to know that For systemic fungal infections, you need to bring so you need to understand that you are going to have different infection here. You have histoplasmosis, which is involved with systemic fungal infection. You have the cryptococcus neoformans, which is also involved with fungal infection, systemic fungal infection. You have aspergillus. Is it clear? You have the aspergillus. You have the next one, the aspergillus. After the aspergillus, you have the after the aspergillus. So those are some infections which are systemic in the cases of fungal infections. And now, so these are how you can visualize the classification of fungal infections. Is it clear? Now, after the classification of fungal infection, we now move to the next one, which is the class of antibiotics which can be used for this fungal infection.